Every year, approximately 240,000 Americans experience a mini-stroke, medically known as a transient ischemic attack, TIA. Despite their temporary nature, these events should never be overlooked. Ignoring a TIA could have devastating consequences, as 1 in 5 individuals who experience one will suffer a major stroke within 90 days. The risk is particularly high for the elderly, who are more vulnerable to such events. Recognizing the warning signs and seeking prompt medical attention can be life-saving and may prevent long-term disabilities. What is a mini-stroke, TIA? A transient ischemic attack, TIA, is a brief interruption of blood flow to the brain, often referred to as a mini-stroke. Unlike a full-blown stroke, which can lead to permanent damage or even death, a TIA resolves within minutes or hours without causing immediate harm. However, it is far from harmless. It serves as a critical warning signal of an increased risk for future, potentially severe strokes. Recognizing a TIA early and seeking prompt medical care can make a life-saving difference. Key differences between a stroke and a TIA. Stroke. Long-term damage, possible paralysis, or death. It often results from prolonged blood flow blockage, causing brain cells to die. Recovery may require rehabilitation, and the effects can last a lifetime. TIA. Temporary, no immediate damage, but a red flag for a potential major stroke. Blood flow is only briefly interrupted, allowing brain function to return to normal quickly, but the underlying risks persist. Individuals who experience a TIA are at heightened risk of severe strokes within days or weeks. The importance of early recognition. Ignoring the symptoms of a mini-stroke can lead to severe consequences, including full-blown strokes, permanent disabilities, or death. Studies show that nearly half of all major strokes occur within 48 hours of a TIA. This makes immediate medical attention crucial. Early recognition of symptoms not only prevents severe outcomes but also allows for timely interventions, such as medication to dissolve clots or surgical procedures to restore blood flow. Recognizing the urgency of a TIA can empower individuals and caregivers to act swiftly. Critical steps. Recognize the signs. Seek immediate medical care. Prevent further complications through lifestyle changes and medical treatment. Follow up with specialists to identify and manage underlying risk factors like high cholesterol or atrial fibrillation. 8 warning signs of mini-strokes in the elderly. 1. Sudden weakness or numbness. This symptom typically affects one side of the body and can involve the face, arm, or leg. Common signs include drooping mouth, arm heaviness or tingling. Why it happens? Temporary blockage reduces blood flow to regions controlling motor functions, leading to symptoms such as weakness, numbness, or difficulty moving certain body parts. While these effects may be short-lived, they highlight underlying vascular issues that could cause more serious and permanent damage if left unaddressed. Immediate attention is crucial to mitigate these risks and implement preventative strategies. 2. Temporary vision changes. Vision issues, such as blurriness, partial blindness, or a temporary loss of sight in one or both eyes, are common during a mini-stroke. A specific condition, known as amaurosis fugax, often presents as a curtain falling over the field of vision. This phenomenon occurs due to a temporary reduction in blood flow to the retina or optic nerve, which may signal significant vascular issues elsewhere in the body. Prompt evaluation by a healthcare professional can help identify the underlying cause and prevent more severe outcomes. 3. Difficulty speaking or slurred speech. Struggling to find words or speak clearly could indicate reduced blood flow to language centers in the brain. This often manifests as aphasia, a temporary disruption in language processing that can involve difficulty naming objects, forming sentences, or understanding spoken words. These symptoms occur because the areas of the brain responsible for language are highly sensitive to even brief interruptions in oxygen and nutrient supply. Seeking immediate medical evaluation when such signs appear is crucial, as they may signal an underlying vascular issue requiring intervention. 4. Sudden confusion. Confusion or difficulty concentrating can mimic fatigue or early dementia. However, TI-related confusion is abrupt and short-lived, typically appearing without prior warning and resolving within minutes to hours. This symptom often stems from temporary disruptions in blood flow to brain areas responsible for cognitive functions. Unlike chronic cognitive decline seen in dementia, TI-induced confusion is reversible but serves as a critical red flag indicating potential vascular issues. Early recognition and immediate medical consultation can help prevent more severe complications. 5. Dizziness or loss of balance. Sudden unsteadiness or vertigo is often linked to dehydration or inner ear issues, but it can also signal a transient ischemic attack, TIA. TIAs occur when blood flow to the brain is temporarily blocked, affecting balance centers. This can cause dizziness or vertigo, often with other symptoms like weakness or slurred speech. TIAs are a warning sign of a potential stroke, and immediate medical attention is essential to prevent further complications. 6. Severe headaches. While less common, severe headaches can be a warning sign of a transient ischemic attack, TIA. TIAs occur when blood flow to the brain is temporarily blocked, often causing intense headaches along with other symptoms like dizziness, vision changes, or weakness. These headaches are typically sharp, sudden, and may be accompanied by confusion or numbness. Unlike regular headaches, TI-related ones are more concerning due to the combination of symptoms. TIAs are temporary but signal an increased risk of stroke, so seeking immediate medical attention is crucial to prevent further complications. 7. Brief loss of consciousness. Fainting or drowsiness can be caused by reduced brain oxygen levels and should never be ignored. These episodes may signal a serious condition like a transient ischemic attack, TIA, or stroke, especially if they happen frequently or without a clear cause. If you experience fainting, dizziness, or confusion, seek medical attention immediately to prevent further complications and reduce the risk of stroke. 8. Tingling sensations. Tingling sensations, often described as pins and needles, especially when they occur on one side of the body, may signal disruptions in blood flow that affect nerve function. This can be a warning sign of a transient ischemic attack, TIA, which temporarily blocks blood flow to parts of the brain, leading to abnormal sensations. When blood flow is reduced, it can affect the nerves, causing numbness or tingling, particularly in the face, arm, or leg. If tingling is accompanied by other symptoms such as weakness, confusion, or difficulty speaking, immediate medical attention is necessary to rule out a TIA or stroke and prevent further damage. Risk factors for mini strokes. Several factors increase the likelihood of TIAs, including high blood pressure, strains blood vessels, increasing blockages. Diabetes, damages vessels and disrupts blood flow. Atrial fibrillation, irregular heartbeat leads to clot risks. Smoking, damages vessels and promotes clotting. Obesity and inactivity, poor cardiovascular health raises stroke risk. Prevention strategies. Preventing a major stroke after a TI involves medical interventions, antiplatelet drugs, e.g., aspirin, reduce clot risks. Anticoagulants help prevent clots in atrial fibrillation patients. Lifestyle changes. Heart-healthy diets with fruits, vegetables, and whole grains. Regular exercise, even light activities like walking or yoga. Quitting smoking and limiting alcohol intake. Managing underlying conditions like hypertension or diabetes. How families can support loved ones. Recognize symptoms. Stay alert for warning signs, especially subtle ones. Encourage healthy habits. Help with meal prep, exercise routines, and medication adherence. Offer emotional support. Recovery and prevention efforts can be challenging. Patience and encouragement are essential. Mini strokes or transient ischemic attacks, TIAs, are critical warnings from your body that should never be ignored. Recognizing the signs early, seeking medical care, and adopting healthier lifestyle habits can significantly improve outcomes and even save lives. By spreading awareness of these warning signs, you help protect not only your own health, but also the health of those around you. Knowledge is power, and sharing this information can make a huge difference in preventing more serious strokes and medical emergencies. Don't keep this vital information to yourself. Share it with your loved ones. Encourage them to pay attention to their health and stay informed. If you found this video helpful, don't forget to like, share, and subscribe to the channel for more essential health tips and updates. Together, we can create a healthier, more informed community.